All right, we are live.
Well, thank you, and good evening for those of you who are able to join us. I'm Mayor Harry Rilling. Joining me this evening is my Director of Health, Deanna Diamore, Health Educator, Teresa Argandesi, my Communications Director, Josh Morgan. I also have Common Council members, Greg Burnett, David Hoovelman, joining us as well. First this evening, I'd like to ask for a moment of remembrance, a moment of silence for the 194 Norwalk residents and more than 400,000 residents, citizens across the United States who have lost their lives to COVID-19. They are our fathers, our mothers, our brothers, our sisters, our friends, our neighbors, all taken too soon. So if I could just have a moment of silence in memory of them. Thank you. May they rest in peace. Well, as most of you know, I have formed a task force to deal with the COVID-19 situation. We felt that it was very, very important to have this task force, which is focused in two areas. One, the logistical areas to make sure that we have the resources necessary to provide the vaccination for as many people as possible, as quickly as possible. And number two, for the communications aspect, so that people will know when the vaccines are available, how they can make an appointment, giving them up-to-date information so that they can have they can be informed as to whether or not they want to even receive the vaccination. So the task force is comprised of many different partners in the city of Norwalk, many of our Common Council people from the hospital, city employees to include my Director of Health, my Communications Manager, and others. So now I would like to introduce my Communications Manager, Josh Morgan, who will do some housekeeping issues so that we can move on with the meeting.
Thank you, Mayor, and good evening, everyone. Thank you for joining us. We just want to let everyone know that tonight's meeting is being broadcast in English, but there is live interpretation available in Spanish and Haitian Creole. For those watching on Zoom, simply select the interpretation button on the bottom of your screen and then select Spanish or French for Haitian Creole. You'll also see that we have American Sign Language going throughout the entire meeting tonight. After a brief presentation, we'll have Q&A with members of the public who are joining us on this meeting. Simply click the Q&A button on the bottom of your screen and enter your question, and we will go through and answer those in the order they are received. Please, we cannot answer or dispense personal medical advice, so keep your questions generic, and we'll do our best to answer those. Also, so everyone knows, this meeting is being broadcast on Zoom and also on YouTube. It is being recorded and will be available to rewatch on YouTube, and will also be shared on the local cable access channel 79. So again, thank you for joining us. You can enter your questions into the chat at any time. And with that, I will turn it back over to Mayor Rilling. Thank you, Mayor.
Thank you, Josh. The bad news is that this virus is still very much with us. I just heard a report about 15 minutes ago that January has become the deadliest month of the coronavirus since the first exposure. That's really, really sad news to hear, because we were hoping that within a year we would be out from under this problem. But apparently we're still very much having this situation, and we want to make sure that we do everything that we can to slow the spread. We've talked over and over again about wearing your masks and maintaining social distance, washing your hands frequently, limiting the exposure, even within your own household, of small groups, so that you don't have the likelihood of not only contracting the virus, but spreading it to others. Get tested frequently. Here in Norwalk, we offer testing every single day at Vets Park and at Norwalk Community College. Get tested frequently because you may have contracted the virus but haven't gotten any symptoms, so you may not realize that you've become a spreader. One of the things that we're experiencing, and I'll let my staff talk more about it, getting the vaccine has been a challenge. The good news is, relatively good news out of Washington now, is that they're increasing the distribution of the vaccine to the various states by 16%. Connecticut had been receiving apparently 46,000 doses per week. We will now be getting 53,000 doses per week, but that's allocated across 169 different communities. So it's a challenge to get the vaccines, and we are committed that the minute we get the vaccine, we will get the vaccine into the arms of people who are eligible based on phase 1A and phase 1B right now. Since yesterday, my latest briefing, as you know, we have put out briefings every single day for quite some time now, and I want to thank my team as well as my communications manager, Josh Morgan, for doing that. Today we're reporting 62 new cases. So far in Norwalk, 8,205 of our residents have contracted the virus. That's almost 10% of our entire city. That's frightening, and we really need to do everything we can to make sure that we stop that spread. I would like now, as I mentioned earlier, I mentioned earlier the two purposes of this task force that I put together. One is logistical, to make sure that we have locations where we can administer the virus, that we have the resources, the human resources, the material things that we need in order to do the vaccine inoculations, do it effectively and do it efficiently. You can make your reservation or appointment by going on VAMS, the Vaccine Administration Management System. My team will explain how to do that. The other part of the task force is communications. We need to make sure that we get out information to the public and here in Norwalk so that we can give them the information they need to make a decision whether or not they want to get the virus, to be able to make an appointment, to know when they're going to be due for the second dose, and just to give them locations and talk about the virus, the vaccine, the efficacy of the vaccine, letting you know that it's safe, etc. So with that, I'm going to turn the meeting over to my Director of Health, who will give you an update on what we're doing in Norwalk and be able to start answering any questions that people may have. So the Director of Health is Deanna Diamore. Deanna, thank you for being here and thank you for all that you've done. You've been working so hard, 7 days a week, late into the late evenings. Deanna and I will talk at 10 o'clock at night or we'll talk at 6 o'clock in the morning. She's been a real champion and I want to thank her publicly. So Deanna, thank you.
Thank you, Mayor. So Josh is just pulling up some slides for us right now.
Just so you know, we cannot see the American Sign Language right now as well. So
you should be able to. There's an option on your. Can you see Deanna?
oh, I can. So is it by interpretation? If people can click on interpretation?
No, you have to click on gallery view instead of speaker view. It's an option.
Yeah, I'm just more concerned about the public knowing that they would be able to see that.
Okay. Well, if you're in the public and you're watching this, click on gallery view and you'll be able to see the interpreter. Thank you.
Larry, let me know if you think I should stop my video, if that would be helpful, if I should leave it on while I talk.
You could leave it on. Yeah.
Okay.
Yep, go right ahead, Deanna.
All right. Thank you, Mayor. Thank you, Larry. So there are 2 vaccines that have received emergency use authorizations from the FDA. We have the Pfizer vaccine, commonly known as, and also the Moderna vaccine. Both of these vaccines are 2 doses. They differ because the Pfizer vaccine is given at least 21 days apart, the second dose, whereas the Moderna, it's given 28 days apart. Both of these vaccines were tested in tens of thousands of adults from diverse backgrounds, including older adults and communities of color. The clinical trial data show that both vaccines are safe and effective at preventing COVID-19 at about 95%. It is unknown how long protection from these vaccines might last, but more, more trials will be done and determined to be able to answer that question. There is encouraging news. There's the Johnson & Johnson vaccine that is currently undergoing trials, and they should be reviewing that data soon. And the thing that's really exciting about Johnson & Johnson is it's a single dose. So in terms of administering it, having people, immunize faster and sooner, that'll really make a lot of improvements. So a lot of us are hopeful, and we're hoping that Johnson & Johnson gets approved with the same emergency use authorization within the next, hopefully soon. Hopefully that'll be the next one. Next slide, Josh. So right now we know, as the mayor was discussing, the supply is limited. So because the supply is limited, the CDC's Advisory Committee on Immunization Practices and the Connecticut COVID Vaccine Advisory Group out of the governor's office, they've set priority groups in terms of the order of the distribution and who gets access to the vaccine first. And so because of this limited supply, the vaccine is not expected to be widely available until the summer. But we're hoping, as if Johnson & Johnson gets approved and others, and production increases, we're hoping, more vaccine is readily available. But right now, we're not looking at, as of right now, we're not looking at the summer and for it to be widely available to the public. And just as a reminder, vaccination is completely voluntary. Next slide, Josh, thanks. So, the city is working really closely with the Connecticut Department of Public Health as we're doing this rollout. There are several local vaccinators in the area. So the Norwalk Health Department is one. Norwalk Hospital has been doing a lot of vaccination. CVS and Walgreens, they've been focusing right now on the long-term care facilities, so the nursing homes and the assisted living facilities. But there is talk, CVS and Walgreens are starting to open some spots in Connecticut, actually in the retail space. So we envision and we imagine that will come eventually in our area, but right now it's more like in the northern areas of the state. And also our federally qualified health centers are also vaccinators. So Norwalk Community Health Center and, the Community Health Centers, Inc. is also vaccinating. And so we're really working to coordinate the response across Norwalk. So, we have, within internally in the health department, we're working across, our staff with the emergency preparedness staff, our immunization staff, and our emergency response team. And we're working obviously really closely with the mayor's COVID-19 vaccination task force and all the partners that are participating in that. And again, broad community partners to looking about how we get people vaccinated in the city. Next slide, please. So this is just some data on the state. So, Connecticut has been really focused on getting vaccination out quickly. They've ranked currently number 4 nationally on getting doses administered into people's arms. So as of Monday, there was 265,947 first doses administered, 42,555 second doses administered. So in total, it's, over 300,000 doses that have been administered. 27% of those 75 and older have received their first dose. And, as the mayor mentioned, really the hindrance to getting people vaccinated right now is just the supply. Next, please. So, I talked about the prioritization. And so what Connecticut has done is they've formed phases. So this is all, the governor has established an advisory group. They're looking at all the recommendations from the federal government, and they're, so far they've been accepting those recommendations. And they've also looked at, are there other groups that should be included within the phases? So phase 1A has been healthcare personnel, long-term care facility residents and their staff, and the medical first responders. So that has been the focus of the first phase. Recently, the state has announced phase 1B. So there are several different parts to phase 1B. So phase 1A started, and all of these groups, vaccination, it was open to, but phase 1B has now been, it's going to be over time within phase 1B. So right now, what clinics are scheduling are individuals age 75 years or older. Next, the state has said that individuals between the ages of
the interpreter?
Of,
You are, okay.
and so just to talk about some of the challenges so far, is the Vaccine Administration Management System, VANS, is an online portal only. It's only in English. And we know that is a big issue for our community. And there's also been that confusion over phase 1B and who is eligible and when can they schedule their appointments. And so we're really committed to equity and access to this vaccine. So we're looking at improvements. We've been using the VAM system, but we're looking and working with the state to be able to transition to use our own electronic health record system, to use our own scheduling, so that people can speak to a person and register, because we know it's very challenging for those 75 years of age, and for many others within our community to be able to only have to utilize VAMs. Next slide. And I believe I'm passing it over to Josh and Teresa.
Thanks, Deanna. So as the mayor mentioned, part of the task force is also focused on communications and outreach. There is a lot of demand for information from the community, and unfortunately at times there's just not a lot of answers. As Deanna had indicated, the CDC, the federal government, and the state and the governor's office are really in control of the timeline and the phases. So we continue to advocate for vaccine and for more information to share publicly, but patience is needed. As we just saw on the previous slide, there's a lot of people eligible for the vaccine in the coming phase 1B, and not enough vaccine to meet that demand. So again, patience is really needed and appreciated. We have set up a couple portals here for residents to get in touch. First, via email, COVID-19 task force at norwalkct.org. That's monitored by members of the mayor's task force team, and we respond quickly to those inquiries. And we also have a dedicated landing page of norwalkct.org/vaccine, and that is updated frequently. It has all the information that we're talking about this evening, links to the state and federal guidance, links to VAMs to make appointments, step-by-step guides. There's some social media posts out there, social media advertisements, different ways to reach the community. But really what's important is we don't forget about those who don't have access to a computer or don't have a device that's capable of using these online systems. So what's happening now and what's going to be happening soon here in Norwalk? Happening now are senior helplines. Thank you to Chief of Community Services, Lamont Daniels, and our Norwalk Senior Center and Senior Services Coordinating Council. We were able to establish local helplines for seniors to call. We did hear direct feedback from the senior community saying that the state 211 and the state helplines were overrun. They were very busy. They weren't getting calls back. So we have these local assistance lines now available. Again, all that information is available at norwalkct.org/vaccine, and there are hard copies out available in the community. Just want to be clear that these helplines are just offering guidance for folks on VAMs, the vaccine rollout, some different information. But we know that doesn't necessarily address someone who can't make an appointment online or doesn't have a trusted relative or loved one to help make an appointment. So what we're going to be launching soon, hopefully early next week, is actually be a way for Norwalk seniors to make an appointment via phone, specifically in Norwalk at one of our clinics. They'll be able to be triaged through the Senior Center and Senior Services Coordinating Council and be linked together with our emergency response volunteers who are trained with the health department systems and all things COVID-19 vaccine related. And for those who do have, are able to get out and they do have someone who can help them, we are going to be making special hours available at both this main branch and Sono branch library for seniors to use the computer to go through the VAM system, and we'll have volunteers there to help get them registered as well. And really, those input was directly from the Senior Center and the Coordinating Council, and that's really part of, like I said, Lamont Daniels and the Community Services Department. So I'll turn it over to Lamont to talk more about this work, because his department is really integral in terms of interfacing with our nonprofit and social service groups, and is really the ear to the ground in Norwalk for what people need to hear and what we need to hear back from them. So I'll turn it over to Lamont.
Great. Thanks, Josh, and good evening, Norwalk. So I'll just be brief to kind of build upon what Josh has shared and really talk about more of the strategy. So as you see, for those that are able to see the slide deck, this Community Services Department is really working to help coordinate with our local nonprofits, our faith community, and our social services agencies. We recognize that we cannot do this alone, and it's important that the services that you use regularly have the most accurate and relevant information. So our department will be working with the nonprofit community and the faith and other communities, service providers in the city to ensure that they have information. So when you're seeking information, you can reach out to them and rely that that's a trusted organization that will provide you information. And then the other point is that I want to encourage the community and those that work for nonprofits. We want to understand what our community is saying. And so most of you know of the Community Services Department and are able to connect with us. So I just want to remind our community that please reach out to the social service supports that you already have or know of, or utilize resources, and let them know what you're concerned about. And that information will get phoned to the city so we can design or develop or respond in a way to ensure that you have the good information and making sure you know when the next clinics are open. So we continue to be on the ground. We continue to want to hear from you. These partnerships are so important as we move forward because the information is coming very fast, very quickly, and sometimes it can be a little bit overwhelming. So just want to remind Norwalkers that we're here to support you. We're here to help you understand what the vaccine is, where to get it, and and where to get your information from, quite frankly. So thank you, and we're here, and I'll turn it back over to you, Josh.
Josh, before Lamont gets off, Lamont, would you please just tell us a little bit about the food distribution programs that we're doing? COVID and the food distribution and food insecurity go hand in hand. And we want to get the word out that if people are experiencing any food insecurity, what we're doing here in the city of Norwalk.
Certainly. Thank you, Mayor. So the city of Norwalk, under our mayor's leadership, is partnering with the Connecticut Food Bank, which is now Connecticut Food Bank Food Share. And so every Wednesday at Calf Pasture Beach, beginning at 9 a.m., if you are in need of food, please come to Calf Pasture Beach here in the city of Norwalk every Wednesday from 9 to 12. We will be able to provide you good food, milk. Today we had milk, apples, onions, canned goods, juice. And I see Councilman Burnett here with us this evening. We were both out there this morning putting food in people's trunks. This is a resource for you. The city of Norwalk is committed to ensuring that Norwalkers, if you are in need of food, we've provided this resource. And so we encourage you to come out. Also, we are a part of the USDA program. Keep a lookout on our website. And Mayor, if it's okay, I also want to recognize the Cornerstone Food Ministries. They provide also food boxes through the Blessing Box program, and has been a very valuable partner with us as we continue to provide the necessary food items for Norwalkers. So every Wednesday at Calf Pasture Beach until further notice. This will go on. We're already scheduled into March. And if you would like to be a volunteer, just look on Connecticut Food Bank Norwalk, Google that, and that will guide you to the volunteer page. Thank you, Mayor.
Thank you, Lamond. Before I thanked Deanna Diamore, Lamond is our answer to the Energizer Bunny. I don't know how he does it. He's very passionate about what he does, very organized, and he also is working 7 days a week, probably 10, 12 or more hours every day. Two other people from the council that are on our task force. I know that the council president, Nick Sachinelli, is listening in. And also we have Darlene Young, who's a representative from District B. But also, Greg, thank you so much. You're always out there every day. We have food distribution and other ways helping out. So I want to thank you as well. So Josh, I'm going to turn it back over to you for any questions and answers, and you can explain how that has to be done.
Absolutely, Mayor. Thank you. And thank you everyone again for joining us here tonight. So folks who are tuned in on Zoom, you can click the Q&A button on the bottom of your screen, and you could enter a question and we will field those as they come in. And again, as a reminder, we cannot dispense medical advice, and we can't offer personal advice in terms of a specific situation regarding someone's personal health. So I do want to just ask if Deanna and Teresa from the health department, because we have gotten questions about this in the past, for someone who is going to get vaccinated, can you sort of walk through what that process is like at one of the clinics that you are organizing after someone gets registered? Sort of what's it like for them when they get there, and sort of talk through the process a little bit, because I know it could be a little overwhelming for someone who maybe hasn't experienced that before.
Sure. I'll take a stab at it, and then Deanna can add anything. When folks arrive at the clinics that the health department runs, appointments are scheduled in 10-minute increments. And so we have a sign posted outside to say what time appointments we're taking right now. So, at 10:30, it'll say 10:30, and then we'll move on to 10:40, 10:50, so that folks can wait in their car where it's nice and warm until their appointment time is ready. And so then once their appointment time is called, they can enter. They're greeted by one of our health department staff members who checks the list of registered folks, escorts them in, and then they're greeted by volunteers to show them where the registration desk is. They'll check in at registration, provide their name, their appointment time, verify their date of birth. Then they're given some information about the vaccine they're going to receive, asked a couple, questions about if they've had any other vaccines recently, see if they have any questions before they move along. And then once they're ready and checked in, they're shown to the line to get in a queue for the nurse's station, the vaccination station. And so throughout this whole process, we've set up a workflow so that everyone remains 6 feet apart and is safely distanced. And so we have a nurse's station comes next, and then they're greeted by a nurse and a medical assistant who is there, reviews their medical history, their information about any medications or medical conditions they have, answers any questions they have about the vaccine, and then provides their vaccination. And so then they'll receive a card with a record of the date that they received their vaccine. And then a reminder card for when they would be going in to make their appointment for their second dose, if it's their first dose clinic. So they get a little card that says, you got this brand of the vaccine. Here's the time that we want you to come back, the day that we want you to come back for your next appointment. They would eventually go into the VAM system to make their appointment for their second dose right now. But after their vaccination, they are escorted to a waiting area where they sit and are monitored for 15 to 30 minutes to just ensure that they're feeling okay before they leave. They can answer any additional questions. There's a nurse available there to answer questions or to give them information. They'll receive a sticker that says they've been vaccinated, that they can wear with pride as they leave the building. And then when they go back home, they'll have an email from the VAM system to say, congratulations on your first dose. Here's a link to make an appointment for your second dose. And that pretty much sums it up. But we've been very fortunate, in addition to the health department staff, as folks have mentioned, the emergency response team has been wonderful. We have nursing staff and vaccinators, as well as volunteers to monitor the flow of people in and out of the vaccine clinic, greet them, answer questions, those kinds of things. So there's always somebody close by, and hopefully everybody is served with a smile, and we look forward to seeing them for their second dose as well.
Teresa, that was a great explanation. The only thing I say, like you missed, was we give them a little card right as they go to sit for medical observation, so they know what time it's safe for them to leave and to exit. So some people are 15 minutes and some people are 30. So that's our way of tracking to make sure that everyone stays for the amount of time they should be on there. But thank you so much for that excellent description.
Thanks, Teresa. We get a lot of questions to the task force email and submissions through the website, but wondering what Mayor Rilling and what our elected council members are hearing from their constituents. Are people reaching out to you directly? What kind of questions, what kind of feedback are you hearing from the Norwalk community?
Well, let Greg and or David answer that first. They're representing, Greg is a council person at large, and David represents District A, which is the Central District of Norwalk. But in reality, all council people represent the entire town. And that's important to know. And we also want you to know that you can reach out to us. You can ask us any questions. You will get an answer. You will get a response, and we'll do everything we can to lead you in the right direction where you need to go. So you want to go first, Mr. Burnett, and then Mr. Hooverman?
Great. Thank you, Mayor Rilling. I think right now the overarching item is clarity of information. Yeah, there's information that is you see on social media. There's information that you see on the television, and at points there's conflicts in terms of when someone should go, when someone should sign up. You know, am I eligible to go, or do the conditions that I have make me eligible to be in one group and not another group? So we're trying to, in Norwalk, we're trying to do everything we can to provide clear and accurate information based upon the guidance that we get from the state and the CDC to clarify some of those mystical questions that people have. So clearly, I think that is a priority right now, getting clear and accurate information to the community. I think overall, this is really a time when we need to really work together and help each other. You know, talk to your friends and your family members and your neighbors, especially that are seniors, and provide them with the information that they need and help them answer the questions that they might have so that they can be comfortable about getting the vaccine and moving on to have, I'll say, as normal of a lifestyle as we can have, or what we're accustomed to having. We mentioned that there's online assistance, there'll be phone assistance for our seniors. But if you have a neighbor that does not have access to online system, take your laptop over to them or your phone and help them walk through the registration process so that they can get an appointment, and help them get to one of the locations so they can get vaccinated. And the reward of doing that will come back to you tenfold in just helping someone else get through this very critical phase of trying to get back to normal.
Yeah, that was great, Greg. I want to add a couple of things, and I hear a lot of anxiety from a lot of people, nervousness, and we've been in this pandemic since last March. We're coming up on 1 year, and a phrase that I've heard constantly used is that there's a light at the end of the tunnel, meaning the vaccine. But the reality is we are still in the tunnel. And we're going to be in the tunnel for a while. And so we have to continue to do all of the things that we have been doing: physically distancing, wearing masks, making sure that we're staying safe, that we're doing proper hand washing protocols. And those things aren't going to end right away. Those are going to take a while. And that's the biggest part of the anxiety. As we move forward with the vaccinations, as Greg said, I mean, anything that you can do to help a neighbor, please do, but also reach out. The email for asking questions is a fantastic way to get information, because right now there's a plethora of information out there. And the things that I hear are people with the nervousness from misinformation or hearing two different points of view that actually don't represent the actual information that you need. We are a community, and we need to remain a community and help one another as we move through this. And that's been the biggest thing, the biggest takeaway that I can leave for you.
Thanks to both of you. Excellent points. I too receive questions all the time, and the biggest issue again is hearing so many different things, conflicting information. Sometimes you don't know what's right. I just received a text message from somebody who was flying back on an airplane, but the airplane was delayed because people had to be told to wear their masks. And they wouldn't wear the mask, so they were taken off the plane. We know the things that are working. We know that masks not only help you stopping the spread, and that's what we thought originally. We thought, okay, that it's just stopping me from spreading. It's not helping me. Now we find out that the masks do help you, and it protects you from contracting the virus. So the information changes on a regular basis. And that's why we wanted to have this task force so that we can keep that level of communications up, providing accurate information. And again, so people can make informed decisions as to whether or not they want the vaccine, but also just telling you what works, keeping that out front, repeating it so that it resonates. It makes people understand that these things do work, and how we can get out from under this more quickly if everybody participates in all those things we know that works. Everybody gets vaccinated, and we will get out from under this. And so it's critically important. Josh or Mr. Morgan, I see we have 3 questions now, so I'll mute and you can.
Thanks, Mayor. And again, just to remind everyone who is tuned in, if you click the Q&A button on the bottom of your screen, you can ask us a question. I do see one. Do you need volunteers to administer the vaccine? I know the state of Connecticut is recruiting volunteers. That web address to go for more information is ct.gov/step-up Connecticut, Step Up CT, ct.gov/step-up-CT. They are asking for volunteers to help at vaccination clinics and administer the vaccine. But I don't know, Deanna or Teresa, for our clinics. Again, Norwalk, the health department is running their own clinics, but the hospital, our community health centers, there's other vaccination efforts happening in Norwalk. We certainly can't speak to what other providers are doing, but we'll offer the chance for our health department staff to weigh in there.
Thanks, Josh. So yes, we've gotten this question in the COVID-19 task force inbox a few times, whether it's vaccinations or other volunteer opportunities. On the city's website at norwalkct.org/city news, where you can find the mayor's briefings and some news about the city. There is a link to fill out a survey if you're interested in volunteering. We have a very robust emergency response team right now, but our volunteer coordinator does look at that survey to see when other folks volunteer, to see if there's any opportunities that we can match them up with. So that's another way to do that locally. But yes, I think the Step Up CT website and then the online survey for city folks is a great way to reach out.
Thanks, Teresa, and thanks for the questions, everyone. There's another question here, which probably should go back to our health department staff. A question: if someone with hypertension or asthma, are they eligible for vaccine in the upcoming group of pre-existing conditions, and are appointments available yet?
So the state hasn't announced or defined that list yet about the specific underlying conditions that will place you in 1B. But we do know that the CDC has a list of the underlying medical conditions that do place you at an increased risk, and then there's a list of them that might put you at an increased risk. And I believe asthma and hypertension are in the might put you at an increased risk for severe illness. So I don't know what the governor's advisory group, which conditions they'll put under at place within 1B at this point. Teresa, I don't know if you have heard anything different, any updated news about that.
No, I haven't heard an update on the list, but just to answer the question about timing, unless folks are 75 and older, we're currently not able to vaccinate them. And we're waiting for more information from the state on timeline for those, for when folks who have an underlying medical condition would be eligible if they're under 75.
Thanks, Deanna. Thanks, Teresa. A question which probably should go to Lamond. Can you talk a little bit about the nonprofit and community organizations you're working with, what kind of sectors that they're covering? And a question: if there's a newly formed group or a new grassroots group, how do they reach you? How do they get involved in some of these efforts?
Sure. Thank you, Josh, and good evening again. We're working with all sectors, both from child serving agencies, family focused agencies. We're working with our Norwalk Public School partners there with the food distribution they offer at the school sites and in the community. We're working with the business sector. So we do work with a variety of sectors to help support and manage the communication and give accurate information. So let me share my email address, which is Daniels@norwalkct.org. If you are an organization that would like to participate in our discussion, specifically some of our community outreach and education, we need you. We need trusted community leaders to be able to communicate important critical information to our community, because if they trust you, they're more apt to consider taking the vaccine. As the mayor indicated, we want to make sure our residents have informed information and make informed decisions in order to take the vaccine. Also, Josh, if I can, I definitely want to promote our seniors, because that is the phase that we're in. So if you are a senior 75 and older, we are partnering with the Norwalk Senior Center. You can also find this information online, but I also want to give you 3 telephone numbers, which is the first number is 203-847-3115. And that line is in English. For Spanish speaking, that number is 203-299-1500. And for the Senior Services Coordinating Council number, that number is 203-434-18 877-888-76. This is a resource for our seniors. Our goal is that as we phase, as the governor and we follow the CD guidelines, continue to do the vaccination rollout, we're committed to ensuring the right organizations, the right sectors have information so you can rely on a community provider or partner to call them and to learn more information. Thanks, Josh.
Thanks, Aman. Thanks for that information. There's a couple questions regarding the vaccine. So Deanna and Teresa, this is probably your wheelhouse. So, and we'll take them both at the same time. So does a Norwalk resident need to get a shot in Norwalk? And if they don't, does the second dose have to be with the same provider where they got the first dose? And then perhaps attached to that are private doctor offices or medical offices providing vaccines right now?
So really, oh, go ahead, Deanna. I just saw you pop up. Related to where you can get your vaccine, once you're enrolled in the VAM system, you can search by zip code for vaccine providers in your area with open appointments. And you, similar to how you might search in another portal, you can make that distance from your zip code wider and wider to see what's available. So no, you do not have to be vaccinated in Norwalk. And you are encouraged to go back to the same provider to get your second dose, just because that provider will receive a second dose on your behalf. For every person we vaccinate a first dose, we will get a second dose. And so you're encouraged to do that. It's not required. And so if you need to make an appointment with another provider for any reason, typically the provider will allow that. In terms of doctor's offices, Deanna, I don't know if you have some information on that.
I just want to add to your point, just to make sure, like the health department, a lot of the health departments and the federally qualified health centers, a lot of them are receiving the Moderna vaccine. So just if you're making a second dose appointment, you know, if you got the Pfizer vaccine for your first dose somewhere else, and then you make an appointment with us, we won't be able to give you your second dose. So you just have to, you know, pay attention to that. Related to the doctor's offices, some of those private practice providers that are part of the larger health networks that are part of, you know, hospital systems, some of them might start having vaccine available, but you really need to check and call, you know, your own provider to see. But that is definitely limited right now.
Actually, and could I just add one more thing? One of the most common questions we get in the COVID task force inbox is, I got my first dose at whatever provider, and I want to make an appointment for my second dose. I don't know what vaccine they offer. You know, how do I know if I need Moderna? How do I know to get Moderna? And so, as Deanna mentioned, the health department offers just the Moderna vaccine right now. But we don't really have information on what the other providers have. So you would have to contact the provider directly. So unfortunately, we don't have that real-time information on, you know, who's offering what vaccine where. You'd have to contact, so if you needed to make an appointment at the hospital, you'd have to contact them. They offer both vaccines and they do their best to match you with what you need for your second dose. But you would have to contact the provider directly. Thanks.
Thanks, Teresa. There's another question in the chat asking about to explain what the sign-up process and VAMs would be like for someone who is 75 years old, and just sharing that it's taken someone they know a couple days to get a message, and it could take up to a couple weeks to get an ID for the vaccine administrative management system. That's VAMS, V-A-M-S. So just wanted to sort of toss that to Lamond. As I had mentioned earlier, we're hoping to get this up and running in the next week or so. We'll also have a phone line available for seniors without internet access to make an appointment. But Lamond, hoping maybe you can share a little bit about how a volunteer or a trusted friend can maybe help someone get through the VAMS portal and get an appointment.
Sure. Thanks, Josh. And Teresa, I'm going to definitely ask you to partner with me but I did have the privilege to help a few seniors actually go online. This is through the telephone, to telephone. So as it stands right now, and we're hoping through the health department to launch a new program where we're even to add another level of support and resources to our seniors. But as it stands right now, each senior, in order to enroll into VAMS, each senior must first enroll into the State Department of Public Health system to enroll into VAMS, which then the state of Connecticut approves their eligibility to be enrolled in VAMS. And it kind of gets a little bit confusing because there's an enrollment and then there's registration. And so the initial piece, and Teresa, help me if I get it right, because I've done quite a few of them. So that's through the state. And so you are right. It can take up at that moment. And I've seen variations. You get the email that night, or it can take up to several days. And the state will say, due to high volume, it can take some time. That depends based on, when you enroll and when the state turns it around. So then it would give you permission and tell you, you now have been approved to register into the VAMS system, which will then allow you to make an appointment. So it's definitely a multi-step process. So for our seniors, what is important is if you don't have an email address, you need an email address. For a loved one, cousin, friend, child, adult, daughter, you cannot use your email address if you also plan to receive the vaccine, because it has to have one email address. So help that elderly person get their own email address. The other piece that I'll raise is, and then Teresa, I'll turn it over to you, is that even with waiting for your permission to be registered, that also can take up to a couple of weeks as well. I have not seen that. I think the longest I've seen, Teresa, has been about 3 days. But I know some people have, although the website does say up to 2 weeks, those seniors that I have registered, it has not. So what will the senior center do? For those seniors that are able, they will walk you through, because I've done it with some seniors and they were successful. However, what we also plan to launch is seniors who are saying, I have no understanding of technology. I don't really understand. Teresa, I'm going to ask you to share, because Diana just kind of briefed me this evening that what we're planning to launch so that we can make sure we take care of our seniors who really need that help.
Yeah, sure. So Lamont points on an important topic where we've been meeting on it and discussing it and trying to come up with a good local solution. And we know there are some phone lines available at the state level, and some healthcare systems have phone lines to make appointments, but it can be a long wait on hold. And so we know people are having various levels of success. So Lamont's correct. Folks we can call the senior center, and the numbers that Lamont listed. They would first get troubleshooting tips on VAMS. Several of us at the health department have walked through the VAMS process with folks on the phone, and after a few times, you start to learn some of the most common stumbling blocks. Lamont points at the unique email address is one of the big ones. You need a unique email address. So if you share an email with someone else, that's going to be a problem. And then we can talk folks through, maybe you got one email, but you're still waiting for another one. If certain little things about filling out the application, we can help people do that over the phone. But yes, we are trying to set up a system where folks who, are unsuccessful on the VAMS process or just don't have access, have barriers to getting registered and getting an appointment that way, would be able to make an appointment more directly over the phone. We hope to be able to get you details about that very soon. And I just want to thank all the community partners who serve seniors and serve residents. We're all coming together to try to work on a system together. And so hopefully we'll have some more details soon, but we are looking at that as an important need that we're trying to fill and make sure that Norwalk residents can get the vaccine easily and have it not cause, stress. That's a good point, that it can be a very stressful process. And so we want to reduce that stress and make it easily accessible.
Great, Thanks, Teresa.
Thanks, Teresa. Thanks, everyone. We have a question about how do vaccines make it into senior communities, perhaps some with no technology, no transportation, medical conditions, and other barriers. And they suggest we need to bring vaccines to them. You're absolutely correct. So these conversations are happening locally and at the state level. The state has committed to mobile vaccination units to reach these hard to reach populations. The homebound senior really comes to mind. So we're thinking locally how we can help identify who these people are and how we can help get them vaccinated. We talked about the vaccine. It has to be refrigerated, it has to be used within a certain number of hours once the vials are open. So there are some logistical challenges going to one house to another home, but the state has committed to mobile units going around. Some more details to come on that, but I definitely want to assure the public that access to the vaccine is top of mind for Mayor Rilling and this task force, because we know that there is a large segment of Norwalk residents who may not have access to technology, who may be homebound or disabled, or may have some language barriers. Unfortunately, the VAMS system right now is only available in English and online. So that's definitely a barrier for some in our community. So more to come on how we can bridge some of these divides that we're seeing in this initial rollout of vaccination efforts. And there's another question here about can you pre-register with VAMS before you're eligible for the vaccine? This is all very confusing. Yes, it is confusing. That is feedback that we are hearing a lot from the public, but I'll let Teresa field that one about any pre-registration.
So for individuals in phase 1B who are not yet eligible, so folks under the age of 75 who will be able to be eligible soon, I don't believe it's possible to pre-register in VAMS, because once you're in the VAMS system, you can make appointments. So, it is possible that folks were registered into the system in error, or got access to the system and have made an account. And if that's the case, then we're asking that you wait until your phase is open before you make your appointment for your vaccine. But my understanding is if you fill out the form on the state's website to express an interest in enrolling in VAMS, if you're not eligible by age or employment status in phase 1A, you will not be uploaded into the VAMS system until your group is open.
Thanks, Teresa. And then we have another question here in the chat about how much vaccine Norwalk is receiving each week. We had shared during the presentation earlier that the state of Connecticut is receiving about 45,000 doses a week. Learned earlier today that is going to be upped slightly, and certainly need to have more vaccine. So that amount of vaccine is distributed amongst all the communities. And again, the Norwalk Health Department is one of a handful of local providers who are providing the COVID-19 vaccine. So we did receive close to 1,000 doses of vaccine this week, and we'll keep advocating and asking for more. And again, when I say that we meaning the Norwalk Health Department, the Norwalk Hospital and our federally qualified health centers are receiving their own shipment and their own doses. So we'll continue to ask for vaccine from the state and make sure that we're getting residents and those who are eligible vaccinated. I don't see any other questions in the chat. I know we still have folks tuned in and logged on. We'll just give it another minute or two to see if there's any final questions to come in. But Mayor, I can turn it back over to you for some final thoughts, and we can close tonight's meeting.
Thank you, Josh. And again, thank you, everybody who's on the panel. Thank you for all your efforts on behalf of the city of Norwalk. And certainly want to thank the people who tuned in, people who are watching on YouTube. These are important times. We have never experienced anything like this. I always say that there was no manual that we had prepared on how to deal with this. We wrote a new chapter every day. Information keeps changing. But they say all politics is local. And we know that mayors and first selectmen and their teams, they can provide the greatest service at the local level. And that's why it's so important for us to be able to make decisions at the local level, to get the vaccines from the state, because the state gets them from the federal government. So we want to get as many vaccines as we possibly can, and so does everybody else. There's a challenge right now. There's a limit to the number of vaccines that are available. As we said twice now, we got 46,000 a week in the state of Connecticut. Now we're supposed to be getting 53,000. Getting more encouraging news out of Washington, where the task force will be focusing on purchasing and obtaining from Pfizer and Moderna and AstraZeneca and anybody else that is going to be providing vaccines. They'll be focusing on getting more vaccines, and hopefully at a $1.5 million, I'm sorry, a 1.5 million dose a day trend, they will be able to vaccinate most people in the country by the end of summer. And we're hoping that happens. Again, it's critically important that we at the local level keep in contact with the community, work together to make sure that we have the best plan in place, the most comprehensive plan, that we have the best and most efficient distribution plan in place, and that we provide information, because that's what people need. You can see by some of the people on the who asked questions this evening talked about how confusing it can be. We understand that. And that's why we want to make sure that we clarify everything that we possibly can. Josh, I see we have 3 more questions that have popped up.
Yes, the last call for questions brought in some new questions, and some of it was addressed earlier, and I'd be happy to answer these, Mayor, then give them back to you. So the questions are non-Norwalk residents able to get vaccinated in Norwalk? And then another question, can people go to other cities and get the vaccine, or do you have to be vaccinated in the city in which you live? So the answer is you can be vaccinated anywhere in the state. The VAMS portal, for those who are eligible, when you log in, will show you all available appointments within a certain geographic radius. So a Norwalk resident can certainly go to Stamford, Hartford, Waterbury to get a vaccine. And likewise, residents from Hartford, Waterbury, Stamford can come to one of the Norwalk clinics to be vaccinated. So it is an open system. And when communities have slots available and they get posted online, they are open to any eligible resident. And as Teresa had indicated before, the second dose vaccine, we get a lot of questions on that. So we do encourage you to reach out to wherever you were vaccinated, to reach out to that provider, because we do not keep a daily update and don't have access to what providers, if they're offering Pfizer or Moderna at their clinics. So Mayor, I will turn it back over to you.
Well, before we close, I was going to ask Deanna to once again remind people about the vaccine clinics, when we're going to be doing them again. Do we have appointments available right now? What's the current status?
Sure, Mayor. So we do have some vaccine clinics this week available where we have open slots. So if you are in the VAM system and you're eligible at this time, you can make an appointment with us. We do have availability. And we will be working in the future, as we described, to be able to offer some vaccination appointments to those who are unable to access the VAM system. But for this week, right now, all the appointments are through VAMs.
Thank you, Dan. And just one last point that maybe you can answer. You said that there's appointments available right now, and we have more vaccines than we have appointments. We've heard places that say they have to throw out the vaccine because they don't have enough people coming in to get them. We don't want that to happen. So what happens in that case in the city of Norwalk at the end of the week we have some vaccines left? How can you distribute that?
So the staff pays very close attention to like how many doses we have. The tricky part on all this is that if once a vial, some are 10 doses and some are more. So often we've been able to get more doses out of a vial than what you would expect. So towards the end of the clinic, we're able to know how many doses we have left. Whether, if we have 1 or 3, we don't let any dose go to waste. We have not at this time let anything go to waste. And so we're able to call people that are within eligible phase to see, are you available to come over right now to come get vaccinated, so that nothing goes to waste.
Thank you, Deanna. And then a couple of people just typed on here, thank you for your time. And I again thank you for your time, and thank you for the hard work on behalf of the city. We're all in this together. We will get through this. As Mr. Hooverman said, we're still in the tunnel, but there is light and we can see it. And it's going to be very refreshing once we're out of the tunnel and in the light again. We're still getting another question. Okay, thank you very much. Megan Stewart said thank you. But again, thanks to everybody for signing on, and please be rest assured that we're going to continue with our daily briefings. We're going to continue this task force and meeting on a regular basis and having hometown meetings so that we can impart the information that people are seeking. We're going to continue this until the problem is over, till the pandemic is gone. And we want the people in Norwalk to rest assured that if they have any questions, look on our website, look on the state website. There are other sources of information. There's no lack of information, so just reach out, and if we can't get the information that you're seeking, we will point you in the right direction. So again, unless there's any other comments that anybody on the panel wants to make, I'll open it up for anybody that wants to say anything before we end the meeting. Okay. Well, again, thank you so much, everybody, and have a good rest of the evening. Stay safe, stay healthy, and God bless.